Okay, so welcome to our session on forging a path towards reunification. What we're going to do today is really focus on the different types of non-parental kinship care categories. So we're going to get a little bit academic and dig into some of the terms that I have found are useful across the board in every jurisdiction to define what type of family a child who can't live with their parents is living in, because that's really going to determine so many things that we've already heard talked about today. How we match families to resources. And specific to this presentation, it's going to be what are the resources for unification for families for children in different types of kinship arrangements. So we're also going to look at some of the barriers towards reunification in kinship care. And there's going to be a couple of big categories we're going to focus on. And we've already talked a little bit about the importance of reunification for children, but we're going to put it in context of the number of children in kinship care and how many kids are missing out on reunification services. This is something that I don't think kinship support programs talk about enough, and I don't think our child welfare agencies are talking about enough. And if you know me, you know I like to push boundaries a little bit, and we are going to push some boundaries today and really challenge ourselves to think about how we can keep the best interest of children in mind, regardless of the type of non-parental care the child is living in. So please throw questions and comments into the chat as I'm going. I will be happy to address it. I'm really looking forward to kind of sharing something that's been on my heart and my mind for the last couple of years as we work with over 15,000 kids here in Nevada, and what we've seen in terms of the services that kids in kinship care have. So we've definitely already talked about reunification in the last session, but reunification, I think, is important to define specifically because we do have an idea of what reunification is if we work in the child welfare system. It has a very specific definition with specific timelines. So formally, legal reunification is that court process when the child is reunited with their parents after removal. When we use the word reunification, or reunification is the number one goal of child welfare, we're really talking about children who have been removed and placed into kinship care, into kinship foster care. And there's a court process by which that removal has happened. There is a process for parents to receive like a case plan, a pathway, things that they need to do to make it safe for the child to return home. And this whole is overseen by a judge. So the reunification process that we're most familiar with in terms of child welfare is one that is very prescribed and has timelines. There's representation for parents. There's resources. In some places, we can all argue that parents need more resources. But in theory, there's resources for parents, and there's something called reasonable efforts that the child welfare agency has to do in order to make sure that parents have a chance of getting reunified with their children. And so reunification is kind of a big push for child welfare. But I want to talk about reunification outside of that court process. So informally, reunification can also occur anytime a child reunites with their parents after there's been some kind of physical separation from their parents. So this could be regardless of if the court is involved at all. It could be regardless of the child welfare system's involvement, the family, the kinship family, the adoptive parents. Kids can go after physical separation. If they go back to their parents, that is reunification. And so it doesn't have to be a court process, but most oftenly when we're thinking about reunification and we talk about statistics around reunification, we're talking about that legal court process. As Trista mentioned in our last session, even in cases where reunification cannot and does not occur, most children will long for relational permanency. And that is a longing to reconnect with your birth parents or your family. I have a child who we have adopted from the foster care system. And even though it wasn't safe for him to return home, it is something that he wants to know about. He longs to know about his birth parents and his first family. And we keep that door open, as most foster parents are trained now to keep those pathways open for children, even when it's not safe for them to go home. It's still important to support those connections for children so that they don't feel disconnected completely from where they come from their identity. If you talk to children who have been adopted, who are adults, you'll find like, I think 70% of them do reach out and look for their birth family or their first family. I think it's really important to keep that in mind, that even if children don't go home in the legal sense, there is a longing in many children's hearts as they reach the age where they can search themselves, that they will be looking to fill those gaps, to write those pages in their book, and to understand more about their own history, where they come from and who their parents are and were. So I want to keep that in mind always as we talk about reunification. It's such a bigger concept than that court process that we often know about. So why is reunification important? If you take a minute just to look in the type in the chat box. I know Sasha mentioned a lot of the real important aspects to reunification, but please let us know why you think reunification is important for children, for parents, for kinship caregivers. Why is reunification important and something we should focus on? And I'll give you just a minute to reflect on that. Oh, I don't know what that was, but I'm sorry, you guys. How do I change that? This is where I need my young staff to please fix this for me. Is that on? Yeah. Where that came from. If anyone has seen this before and knows what we need to do to get it off the screen, just let us know. Meanwhile, you get a chance to think more. Okay. I've never seen that before, but of course it happens. So someone says helps the child remain hopeful while out of the home, helps the kids see that relationships can be fixed with some hard work. Absolutely. Why else is reunification important? I know, right, Tiffany? Like, of course. Like, this is why I can't be in charge of anything. Seeing the family as a unit. Reduces feelings of ambiguous loss. Yeah. Thank you all for sharing some reasons why you believe that reunification is important. It's important for all of those reasons and so much more. Yeah, Teresa says children love their parents despite whatever happened and want to be with them. I think for those of us, which I think is almost all of us who work with kids, and if you work with our population long enough, you know, as an adult, I can feel really angry about what has happened to children. And I do a lot. I mean, I know all of us can feel incredible sense of anger and, you know, towards parents, even for what's happened to the kids that we end up working with. At the same time, working directly with kids, we see so often that kids bring this sense of mercy and forgiveness, and they want to be with mom, and they want to know, you know, what is going on in their first family. And I think it's important to always honor the child's perspective in all of this, and kind of hold both those things can be true. Horrible things can happen and we can be really upset. And at the same time, to be able to honor what children bring in, what they need is critical. So, and so, Michael says there's questions only the parent can answer. Absolutely. If you've ever, you know, if you are adopted or have you not been connected to parts of your family, in my family, there is adoption. And so I don't know part of my family tree. You always sort of feel like, oh, I wonder why why do I look like this? Why do I act like this? What happened? And those questions can feel sort of like a black hole. And it's important to be able to know those things and get those answers at the most basic level. So many good reasons to support reunification. And of course, research shows that when kids can be with one or more of their parents, they do have better outcomes. So if we can facilitate that path home, it is important. So children really should be with their parents when it is safe and appropriate, and that's not always the case, but I do believe it's probably more often the case than we're seeing happen right now. Children do better when they are with their parents in safe circumstances, and when they can't be with their parents, we of course at Foster Kinship strongly believe that their family is the next best thing. But we also know that kinship care is not a panacea for kids who can't live with their parents. It doesn't fix everything. Just because a child gets to live with their grandma instead of strangers in foster care, that doesn't fix a whole lot of the pain that that child has gone through. And sometimes I see our child welfare system say, oh, well, we kept them in their family, therefore we are basically not separating them from their parents. No, anytime there's a physical separation of a child from their parent, there is trauma. And we have to acknowledge that and give, the child's voice and world that chance to heal. And we can't just say, oh, grandma's just the same as mom. It's just not true. And I would like us to, as a profession, really acknowledge the pain that even kinship care can be for a child who would rather be with their mom. So we don't think it's a substitute for parents. We think it is a better alternative than having to live with strangers. But we absolutely don't think it's the end all be all for a child. So it's usually in the child's best interest to utilize reunification strategies as much as possible when the child can't physically return to their parents. And this is really because of some of the things you've already said. But it's important for children to see adults that they love working together on their behalf. It's really a challenge when a child's safe person, who might be their kinship caregiver, is also displaying in front of them real anger or upset towards the child's parents. Because when that happens and there's not that partnership, the child feels that divided connection. Who do you have loyalty to? And it could be really hard to help children learn to develop healthy boundaries with people who may not be safe if they don't know how to work with somebody who is not in their best place. And so we have to help families figure out how to work together as a team on behalf of the child, even if the child can't go home. And in times when the child can go home, it's really important for us to be able to see that grandma is still there and able to care for the child. And there isn't a rift between mom and grandma, let's say, that means after reunification has occurred, the child doesn't get to see their caregiver anymore. That is also extremely damaging. So reunification efforts are really partnership efforts, and partnership efforts are so, so important in this field. And that's what we want to talk about more. And like Trista has already said, and we've mentioned about relational permanency, 60 to 70% of kids will still seek out their parent at some point, even if they can't return home. Oftentimes, if there's not an open relationship between the child and the child's caregiver, adoptive parent, kinship family, guardian, they may feel like it's not safe to ask their questions about their birth parents, ask their questions about that they have about reconnecting. And so a child may feel like they have to do that in secret, and they may do it once they hit 18 and have more autonomy to seek out that family. I strongly believe that it's better to have open dialogue with children who can't return home, because don't want them to feel shame for wanting them to know their parents and where they come from. I think it would be, in everyone's best interest to have those hard conversations and create that safe place for children to explore where they come from, who they are in their guardian or adoptive home, but keep the communication open so they don't feel like they have to hide such a critical and important part of themselves. So when we think about through the eyes of a child, why is reunification so important? When children haven't had the relationship between their parents supported, they can be resentful of the system. They can become resentful of their guardians or their adoptive parents. They may also develop unrealistic expectations of their parents. They may remain secretive, like I said, when seeking out their parents. And if parents are still in an unhealthy place when children are kind of secretly reaching out, it can cause the child to be at risk of being manipulated or taken advantage of. And especially with social media now, it's very easy for kids to be connected to people that we may not be aware of as the adults, the safe adults in their lives. And that can be dangerous if a child hasn't been taught what healthy looks like, and they might have unrealistic expectations of what they want from their parents. And supporting parental connections, even when the child cannot physically return home, will build trust between the child and the caregiver. and it will teach children to have those healthy boundaries. Sometimes parents don't get better and they don't get the help that they need and deserve to become the parents that the child needs. And in those cases, the children might still want a relationship, and it's up to us as the healthy adults to be able to partner and teach children how to make sure that they're not putting loyalty to their parent over the health, their own mental health, their own physical health, their own well-being. So I want to talk a little bit about a couple of barriers to reunification that we see, specifically in the kinship dynamic. There are two barriers that we see overall, and there's probably more, but we're going to address two today. The first is kinship family dynamics, and the second is a lack of structural support for informal kinship families. The kinship family dynamics barrier, it really impacts all kinship families, whether they're in foster care or not in foster care. So that one is relevant to all the work that we do. And then at Foster Kinship, we've identified what I think is a very serious ethical concern about reunification for our informal kin, which we're going to get into in detail. Now, this is reunification assuming that there are no safety issues and assuming that the parent is an able and willing parent. We see that there are times when kids don't go home when they probably should go home. And that's what we want to talk about, is we're assuming that the safety issues have been resolved, and we're assuming that the parent is able and willing at this point. What are issues that we see as barriers? And these are those two things: the kinship family dynamics and a lack of structural support for our informal kin. So if you want to go ahead and type in the chat box some of the emotions that kinship families bring into the relationship with the parent and with the child when they first take on kinship caregiving. And I want especially those of us who have experience in the foster care system to contrast this with our traditional foster parents. I was a traditional foster parent myself, and I can tell you I was so excited, dragging my husband to class, and we're going to become foster parents, and we got to sit in training child free because we were just learning. And we were just like so excited to get a first child in our home and to do all those things that you see so many traditional foster parents want to do. We were prepared, we were trained, and by the time we got that first child, we were ready. We had the crib, I had a closet full of clothes. I was car seat installed, I was trained, and we got paid immediately. So for us, that call was a joyful call. We were so excited. We don't see that with our kinship families. And that is because they're often getting that call in the very middle of the night. Hey, come pick this child up. Your baby is at Child Haven. Your grandchild is over here in the hospital. Dad's going to jail. Whatever the situation may be, their decision to say yes often arises from a point of crisis and not a planned decision-making with training and money involved where they're ready to go. So when we think about kinship dynamics, yes, I want to really reflect on how different it is at the beginning of that case. I'm going to review the chat because we got so many good: shame, resentment, anger, and disappointment. They're not trained, they're not ready, stress, anxiety. Erica mentions that parents can feel relief because they know their children are going to be going with their mom or their sister instead of with strangers into the foster care system, which can cut both ways, because we see sometimes because a child is with their family, the parent might feel less motivated to work on their plan as fast because they're like, oh, well, my mom would never take my baby away from me. She'd never adopt the child. So there's things like that that can happen. But certainly from the child's perspective, it's way better to go with grandma than to be with strangers. I had a wonderful kinship placement worker that came to our last conference that said, she gets to see the kids who are at our shelter, who are waiting to be picked up. She gets to see the joy on their faces the second they see that family member walk through the door, and they get to leave with someone that they know and love. And to me, that's what we should all remember, is from the child's perspective, you get to go home with grandma after something hard has happened. That is way better than like going into even my house. I think I'm a great foster parent, but let's be honest, I am a stranger. And that is really scary to a kid who's already gone through a lot. Okay, so I think we've kind of covered it. Dr. Joseph Crumbly has a really good series on engaging kinship families that I recommend everybody watch if they work with kinship families. It's required training at Foster Kinship. He talks about the dynamics and the differences of engaging kinship caregivers in terms of the grief and loss that they're experiencing, anger, fear, projection. There are so many emotions that kinship families are coming to the table with. And I think one of the things that we see at Foster Kinship more than anything else is anger. We see a lot of anger, and we see people are just frustrated, stressed, anxious, and in that trauma brain, like Trista had talked about this morning. It is tough. When kinship families first come to our services, it's usually within a couple of days of having children in their home, and they're mad. They're real mad, and they're mad sometimes at the parents and the fact that they had to step up. They may feel afraid. They may feel very anxious because they just don't, of course you say yes out of love, but like, how are you going to feed 6 kids and how are you going to make this work? And there's a lot of confusion and anxiety around what's going to happen next. Is there a court process? It's people are starting from no information. They're working from a trauma brain. And so they're not able to hear things clearly the first time. Of course they're not. Like it's chaos, and they're dealing with kids who've been through a lot. And so it is not a happy, joyful time, and it takes a minute to build some trust with caregivers. And that's why at Foster Kinship, we are so concerned with having a hospitality model at the front end and listening and empathy to build that trust so that our model can work, so we can get families stable. We need to make sure that we're helping families say, hey, it's okay. We understand you're angry. It's okay. We understand you're mad at your daughter. We understand you are feeling like you failed your family, or you feel some shame right now because this is happening. We have to create space for those family dynamics to come out safely. And a lot of times, kinship care and foster care system, it's hard because our foster care system needs families to come quick and to be in alignment with them and to be on board with reunification immediately. And, if you've got an aunt who's like, yeah, I know my sister, she's been using for years, nothing's going to change in the next few months. Why do I think that these kids are going home? You're going to hear, the department say, oh, well, this aunt is not in alignment with our goals of reunification. And instead, we want to create space for what that family is bringing to the table and say, it's okay. You have this history with your sister. You are feeling angry. We understand. And you have to create that space. Otherwise, you're going to not have any trust built with the family, and they're not going to be able to hear you at any point to get on the same page with what's best for the child. So I'm just looking at the chat. Roseanne says, kinship caregivers are sometimes dealing with the parents' anger as well and taking the blame for the kids being taken. How often do we hear, especially grandma say, my son thinks that this is my fault, that I'm doing this to him. And of course, that's where parents can be in their own grieving cycle and their own denial phase, but absolutely caregivers can be blamed for this. And it's hard to see, when you step up and say yes and do the right thing, to also see the family feel isolated because the rest of the family may say, what are you doing to so-and-so in our family? Why are you doing this to them? So there is a lot of emotions to juggle at the beginning, and it's something that any support program needs to be well-versed in identifying and creating space for, to make sure that those families feel heard so that they can hear you. So I want to talk a little bit about non-parental family types. And we have a training on this on our website too, of non-parental family types 101, which we go into this, but I like to talk about the different types of arrangements that children can be in, because it helps foster kinship identify all of the different resources that are available to the child and to the caregiver and to the parents. And so I've listed down below 5 different types of families that children who don't live with their parents can be in. And just take a minute and sort of decide amongst yourselves if you think that it's going to be on the side of inside or formal care, or outside and informal care. And I will give you about 30 seconds to just think through, traditional foster care, private kinship care, licensed kinship foster care, diverted kinship care, and unlicensed kinship foster care, because we're going to kind of explain how reunification looks in each of those types. So I'll give you a few minutes to think about it. Okay, so those of you who are familiar with traditional foster care, that is definitely on the side of inside care. I'm using the term inside as opposed to formal care. The ABA recently and Grand Families recently came out with a great 13-page sort of resources inside the system and resources outside the system. And I think that inside and outside is more clear to those of us in the profession than using formal or informal. But we're going to use both because in kinship care, you hear the word formal kinship care and informal kinship care. So I'm going to say inside or formal care, outside informal care. So traditional foster care is the simplest to understand. It's foster parent like myself, who's a stranger to the children, who's trained and paid, and the child is in foster care. And so we have traditional foster care on the inside. Private kinship care is like the direct opposite of traditional foster care. Private kinship care happens when a kinship family steps up and there is zero child welfare involvement, no call in the middle of the night from a child welfare agency. The caregiver decided, and it may be with or without the support of the parents, that the child should be living with them. And the child welfare system is out of it. So think of it as no government involvement arrangement, and the family may have the children living with them. They may have some form of legal arrangement. But the thing about private kinship care is that is a completely private arrangement between the family. Yeah, like a family arrangement. Absolutely. Licensed kinship foster care. Most jurisdictions have some form of licensed kinship foster care. This is when the child is in foster care, so inside the system, and the kinship family is licensed as a foster parent. And so calling it licensed kinship foster care. In Nevada, it is not required for kin to be licensed. However, in a few jurisdictions that are, I think, here today, it is a requirement. And so almost every state will have licensed kinship foster care. They might call it slightly different. It's inside the system. The child is in foster care. Now, diverted foster care, kinship care, happens when the child welfare agency is involved. So this is where it gets very kind of gray and messy. Diverted kinship care happens when there is child welfare involvement, and the end result of that child welfare involvement is that the child is physically separated from their parent and living with kin. However, when it's diverted, you can think of prevention. Their child is not in foster care. So what may happen is child comes to the attention of the child welfare agency, and the investigator finds grandma and says, if you come and get the child now, we don't have to open up a foster care case or remove the child. You can go get guardianship, and we're out of your hair. You're on your own. So a lot of times this is something that the family really wants. So maybe the parents are like, no, I don't want my child in care. Please let me voluntarily give the child to my mom instead. And the child welfare agency says, okay, go get guardianship and we'll close the case. There is we could do a whole day on just diversion, and we probably will someday, but there are appropriate diversions and there are inappropriate diversions. And the scale of appropriate to inappropriate really depends on the parents' rights, and if they are voluntarily saying, yes, I want this, or if they are not in agreement and now we're making decisions outside of a court system that really parents have rights to make. So diverted kinship care ends up looking the same in terms of resources and services as private kinship care. They are outside the foster care system. The only involvement with the system is that initial arrangement was made as part of involvement with CPS. And then unlicensed kinship foster care. This is inside our foster care system. Not every state has or allows families to be unlicensed, but most of them do. And so the child is in foster care, and there's a judicial process for the parents, but the kinship caregiver is not licensed, which means that they are not being paid the same as foster parents, if anything. And there's probably little to zero training, although there's still oversight from the foster care system on the child's safety, and for the parents, the caregiver is kind of doing the work for free, is how I like to put it. They're doing all the work of a foster parent without getting any of the benefits. I think it's an equity issue, but again, we could spend a whole nother day on that issue. So if you look at this, we're like, okay, there's two types of families on the outside and three types of kinship or three types of non-parental care families on the inside. So looks about even. There's more families on inside of the system than on the outside, right? Wrong. So if we look at this, this is the Nevada numbers, but this is going to be basically the same in every one of your areas. There are so many more kids in kinship care outside the system than there are on the inside. So this Venn diagram shows the overlap between kinship care and foster care system. And so you can see on the outside kinship care, we've got 28,000 kids who are outside of the foster care system, not living with either parent in Nevada, who are living with kin. And that includes our private families and our diverted families. And unfortunately, we're not able to track our number of diverted families. It's not tracked in pretty much any area, so we can only guess what the percentages are. But we think it's, a pretty big percentage of those kids have had contact with the child welfare system. And then the smaller orange circle represents all kids formally removed from their parents and living in foster care. And the intersection of the Venn diagram are those licensed kinship foster parents, unlicensed kinship foster parents. So for in national numbers, there's one child in kinship care in the system. There's about 18 on the outside. Nevada actually has a pretty high placement rate with kin in the system, which we applaud ourselves for that. I think that's great. So there's a little bit less of a difference, but still, if you look at the number of kids outside the system compared to the number of kids in the system, it's a huge difference. It's a huge difference. Why does it matter that it's such a huge difference, right? Because especially with Families First, we're all talking about prevention, and foster care outcomes are bad, and we don't want kids in foster care, which we would agree with in general. We don't want more kids in foster care. But why does it matter that there are so many children outside the system, but not living with their parents? And I can tell you it matters in a couple of ways. It matters in terms of what resources the children can access. It matters in terms of what support the caregiver has over the long term. And it matters because birth parents don't have a path to reunification if the child welfare system is not involved. So I'm going to give you a moment to review the chart. I hope you can see it. On the left-hand side, it just talks about private kinship care, diverted kinship care, unlicensed, licensed, and traditional foster care, all the numbers we talked about in the different types. And then it shows the different types of resources that families have access to. So as you're looking at the chart, please type in the chat box some of the things that you notice, and I'll make it a little bit easier for you by sharing you which types are outside and which types are inside foster care. So what do you notice when you look at what resources families have available to them based on their family type? So if you look at private kinship care, which is that first family type, there's no X in the box there's no assisted reunification through the child welfare system. In Nevada, they don't have access to a certain type of guardianship. They can't adopt from foster care, so they can't get that adoption subsidy, but what they can do is file private guardianship or do private adoption. So if you look at the ones that are green, the paid options, permanency options, I think it's pretty clear that if you're inside the foster care system, you have access to better forms of supported permanency. So for example, if you adopt from foster care, you can negotiate an adoption subsidy in many cases, and you can also negotiate to keep certain types of health insurance for the child until they're 18. Kin gap is like a really big buzzword in the kinship field right now. Our states have kin gap, which is this great alternative to adoption that is a subsidized form of permanency that doesn't require adoption, which is a wonderful, beautiful option for families. But kin gap, you'll see, is actually only available to children who are in licensed kinship foster care. And so it is not available to most children in most kinship homes. So there's definitely no forms of supported permanency outside the child welfare system, but there's also no supported reunification outside the child welfare system. And that is what we're going to focus on today, is these structural differences to getting kids home. When a kid is in the foster care system, we talked about the legal reunification process kicks in with timelines and judges and lawyers and reasonable efforts. And when a child is not in the system. None of that exists. So how is this affecting reunification? Well, while outside foster care is not tracked, so we can't really get good numbers on the number of kids who are reunifying outside the foster care system. It's not tracked in any consistent way in any of our national or administrative data. Informal placements, foster kinship, we've served 15,000 kids, and we track this, and we track if kids go home or not. From our data, the kids who are in informal outside care, only 10 to 20% of those kids are reunifying. That is a small number. We also, if you look at data from the American Community Survey, they do ask about custodial grandparents, and about 40 to 50% of our custodial grandparents, which means no parents in the home, are saying they're caring for their grandchildren for more than 5 years. So, and if you know reunification timelines in the child welfare system, we're looking at 2 years, right? That's kind of the target, is trying to make a plan before 24 months. So we're seeing a lot of kids staying in informal outside care and kinship care. Compare that to the data that we do have on formal reunification in the foster care system, which is between 50 and 60%, depending on where you are, of kids in those situations will go home and be reunified with their parents. So for me, what I started noticing in the last couple of years was, number one, how amazing kinship families are when they step out. That's really good for kids. How great it is when foster care doesn't have to be involved, because that can also be really good for kids and families if the foster care system is not there, making life kind of hard in some ways. But I started noticing more and more how it seemed like there was a very slim path to supporting kids going home if they weren't in the foster care system. And no one's looking at it, and no one's supporting it, and no one's tracking it. And so we're starting to feel a very large ethical concern around, if we're going to continue to support kids out of the foster care system, but they're not with their parents, what are we doing to make sure that there is a path home for those children? So the big disparity between outside and inside is simply this: there is no formal path to reunification outside of the foster care system. It does not exist. There is no oversight, there is no support, there is not a legal consistent pathway like there is under ASFA and all of the federal guidelines and laws that dictate how we operate in child welfare. So when we talk about our child welfare system having the number one goal be reunification, but we see a lot of kids who touch the child welfare system diverted into informal outside placements, reunification is no longer the main goal because there just is no support for those kids. And again, remember in the beginning, we talk about grandma is not a replacement for mom. Grandma is better than living with strangers in most cases, but it is not a replacement for that child for mom. So from a child's point of view, if we're saying we're keeping you with your family, yay, but we're still physically separating you from your parents, ooh, sad, and there's no way home, I think we're missing something. I think we're missing an important part of the piece, important piece of the puzzle. And I think it's only going to get more difficult as we move forward in some of these new prevention plans, which is great as long as we're not physically separating parents and children without a plan to get them home. Because if we reduce our foster care numbers to 0, but our kids are still physically separated from their parents at the same rate, I think we're going to see similar negative outcomes for kids. I think we need to think more about making sure kids have pathways home and less about reducing the number of kids in foster care. Let's reduce the number of kids in non-parental care. Let's figure out how to keep more kids with one or more of their parents and get them home, as opposed to just looking purely at our foster care numbers, because our foster care numbers do not tell the whole story. Our foster care numbers are looking at about 13% of kids in non-parental care. So this is national. So 13% of kids in non-parental care are accounted for in the foster care numbers that we're working so hard to prevent, which we understand and support. But 87% of kids who can't live with their parents are not having any support to get back to their parents. Kids outside the system and families and parents, they're on their own. And I just think it's really important for us to start talking about it. So only 7% of kids in kinship care are going to have a court-assisted reunification process. And And someone said there's also no support for parents. And absolutely, this is a parents' rights issue. We always speak to it from a kinship issue perspective, because that's what we do. But this is a parents' rights issue too, and services for parents. So as communities, we have so many ideas for how we can do it better, but we know we have to do better for the whole family system. So 7% of kids in kinship care will have a court-assisted reunification process. And most of our kinship kids are on their own. They're on their own to figure out how to get home, if to get home, when to get home. It can feel unsafe on both ends. So some of the things we've seen at foster kinship include a family who is diverted from the foster care system into a temporary guardianship, like Sasha had talked about, and the family didn't know how to assess the safety of the parents. And temporary guardianship actually is sort of a meaningless piece of paper in our state, where the parent can change their mind at any time and take their children back. So if the grandma or the relative was not adequately equipped to know when it was safe for the child to return home, we have unfortunately seen some situations like that, which resulted in great harm to the child. The parent wasn't ready, it wasn't safe, but the relative didn't have the tools that they needed to make that decision. And because there was no agency involvement in those cases, they were on their own and they made a decision that ended up harmed the child. We've seen that several times. But we've also seen the other end of the spectrum, where because of the family dynamics, a caregiver was not ready to let a child return home when the parent had potentially made the changes that they need to make. They were, in a safer place and able and willing to parent, but because of the anger and the dynamics between the caregiver and the parent, they were fighting over custody of that child. So we've seen on both sides that without a court-assisted process, that sometimes things can happen that may not be in the best interest of children. And so we have a couple of ideas that I'll go over. I just want to mention that before we get to solutions, we think that this issue is only going to become more and more present and to the forefront. And we want to start the conversation from a Navigator perspective on the kin level, because with the Families First Prevention Services Act, there is a huge focus on prevention. And one of the ways the Act defines prevention is keeping children with kinship families and not formally removing them into the foster care system, providing services to the parent and to the kinship family in theory, and to the child without having the child in foster care. So what we know a lot of states are going to do is going to heavily rely on kin to step up as those safety prevention plan resources. And we are going to want to make sure that in those cases that we're not seeing more families diverted without access for that child going home. Because again, physical separation from the parent, even if it's not legal, is the same to the child. They're not living with their parent anymore. So anytime we're physically part of separating a child and parent, let's make sure we're thinking about a pathway home. And right now with diversion practices, that just simply doesn't exist. So what are some solutions? We have a couple of solutions to both of these things that we would like to share. We first want to address some of the emotional solutions that we've come up with based on some of the family dynamic resistance to reunification and how we work with kinship families. And we also want to talk a little bit about some structural changes that we'd love to see for our informal families. So from a emotional resistance perspective, so like I mentioned, a lot of times when we're starting to work with kinship families, there is anger, grief, shame, loss, and trauma. And it's not a happy meeting. The first time we're meeting with the kinship family, it's not happy. It's sad, it's anger, it's grief, it's shame. And so there can be a lot of emotional resistance to reunification, especially if that's the first thing out of our mouths. So how do we get through this emotional resistance and work with kinship families? Our best practices include, number one, making sure that there is plenty of space to acknowledge the feelings and the frustrations that caregivers are experiencing. We are caregiver first hospitality. We are here to make sure that a family can have this safe place to 100% let us know how they're feeling. And to create a safe place, you've got to create safe people. And so that's why it's so important. Everything Trista talked about in our trauma-informed work for professionals, we as professionals to create a safe place for kin have to be safe, which means we have to be aware of our own triggers and biases and what we bring to the table. We have to be prepared to be vulnerable and to share our own stories and to create a real sense of psychological safety when someone comes in. One of the ways that we are successful right off the bat is very simply not having a badge, not being part of the child welfare agency. We leverage our position as a nonprofit support service very heavily. And we also make sure that most of our staff, if not all, have some form of lived experience that they can tap into and share with the caregiver to build trust and create safety. I know how you're feeling because I was a caregiver, or because my sister struggles with addiction, or because I was raised by my grandma. Being able to say that as a professional and in the relationship that you're building with the caregiver is so critical to building psychological safety and creating that safe space. We also create an actual physical safe space where we try to make our offices look very much not like any other government offices. We're a nonprofit, we're poor, we don't have a ton of money to make it look super fancy, but we do try to make things look welcoming and warm. And it's very intentional, because when people come in and they feel like they're in a government office, their anxiety can spike. I'm one of those people, when I go to a doctor's office, my blood pressure goes up just by being there. And so what we're trying to do is actually, with our space, make it very safe. And then we say, listen, it's okay that you're angry. I hear that you're angry. I hear that you're sad. We can sort of just meet them where they are and allow, without judgment, making sure that they get a chance to say how they feel. And when you can do that and let the emotion come out, you can move through the emotion. If we're not acknowledging space for the emotion, that emotion stays stuck and we can't move through it. I tell my staff all the time not to take things personally. It is really hard when you're trying to help someone and you're like, I have information that would be good and helpful for you, and they're yelling at you, to not be like, well, never mind then, I guess I don't want to help you. We have to always remember that a family is coming to us in a place of crisis and trauma, and we're here to listen and be empathetic, and then to provide the information. And if someone's going to yell at us, we can say, I hear that you're angry. I understand why you're angry. I agree that this doesn't feel fair. Whatever it is you can say to diffuse the situation, but we can't take it personally, because it's not about us. And 90% of the time, the family will at some point be like, yeah, I'm really sorry. I was just really stressed. I just really needed to get that off my chest. Or it's not about you. I just can't believe this is happening to me. And you can get to those more comfortable moments by allowing that discomfort and moving through it. So it's really important, if you're doing kinship support work, to have the right people for the job. When you have the wrong person on the job who doesn't have empathy, or is a box checker, who's just going to give someone information and not create that safe space, I can tell you 100% it will not work. Everyone leaves crying. You don't get where you need to go. So if you're in the business of looking for who's going to be doing this work in your agency, really look into the competencies of the person you're bringing on and make sure that they can create that safe space with others. A second thing that is really helpful is help caregivers be a buffer for their caregivers. So especially if you've got working with formal caregivers in the foster care system, they'll share things like, wow, my daughter showed up in the middle of the night and banging on the door, and I don't know what to do. And should I give her the kids? It's like, no, absolutely not. And you can explain what the expectations are for a child. It needs to be safe with you, and your first responsibility is to the child. And if there is a caseworker involved, let's let the communication go through the caseworker. You don't have to have hostile threats aimed at you through your social media, your text. You can block them right now. Right now, you're focusing on creating safety for your grandchild. So you can really start helping families practice good boundaries and learning, okay, what is it appropriate to partner? What are the things that parents are going to show they're ready to partner? And when is there aspects of potential manipulation or confusion that you can help diffuse as a professional and explain what good boundaries look like? A lot of times our families come to us and they don't have good boundaries to start with. They may be in a codependent relationship with their daughter or their son that has been suffering from issues with addiction for a decade. And they're so used to focusing on their child's issues that it's hard for them to refocus on that grandchild. And so it's really important as professionals that we acknowledge their grief and the sadness and everything that they've done to try to help their child, while at the same time carefully setting boundaries and focusing now on the safety of that actual child, the child under 18. This is really good practice, especially too when parents do recover and can do the things that they need to do to start meeting those boundaries and softening some of those hard lines. You need to have, this is when it's safe. You need to have those conversations. I also think it's really important to listen to caregivers because they are really knowledgeable about the child and they know what's going on in their family. Caregivers are so often discounted and like, oh, well, that person's just angry. Yeah, she's angry because she actually has a lot of information that may be helpful if we could hear. And so a lot of times families are just really discounted, even though they bring really important things to the table. And when someone feels disrespected and not heard, you know, it almost never goes well. We're not building that trust. And so we encourage our child welfare partners to really listen to what the caregiver is bringing and to listen past the emotion. Because a lot of times you hear the emotion like, that person's too difficult to work with. That person's not in alignment with our goals of reunification. That sister is so mad, you know, we're going to have to remove that child. And I think we're missing something. We're missing that you have to hear past the emotion into the truths of what the caregiver can bring and be able to help the caregiver draw that out. You know, Trista talked about respectful advocacy. It's something we teach in our classes because a lot of times if we're leading with our emotion, we're not going to be heard. But also if we're only hearing emotion as professionals and not sort of having mercy to look beyond that, we're discrediting families without realizing how much good information they are bringing about the child and about the family system. So take a moment to give them credit and take the caregivers into consideration. Caregivers need to be supported if they're going to be supportive of reunification efforts. When we don't support our kinship families, there's no way they can focus on things like getting a child home. We have to focus on building better supports for kinship caregivers inside and outside the foster care system. We have to focus on support groups and peer mentoring and physical resources so that caregivers are like, yep, I can do this. And I can think past my own trauma and my own basic needs into what this child needs. And when you can do that, when you can validate a caregiver's emotions, listen to what they're bringing to the table, build trust, start training about some of the trauma, start getting them to be on the same page about what children need, you will have the best supportive partners towards reunification, better than any foster parent I've ever met. And I speak as a foster parent. When we can get a kinship family on board with what's best for that child, there is no better partner. And so we start by supporting the caregiver, meeting them where they are, and then moving into those conversations about what the child needs. And that's how we found it's more effective to get a family on board with reunification. On the structural side of the issues that we're seeing for our informal families, where 87% of kids in non-parental care don't have a clear pathway to reunification, we want to talk about some really big changes that we'd like to see. We would love to see that our child welfare system is very careful around how they use diversion and really have a definition and an acknowledgement of when is it a voluntary appropriate diversion and when might it be a tactic to sort of like get a case off your desk or, you know, not have to do as much to provide support and services to the parent, because we see both. And so if our child welfare agencies are held to account, we hold their feet to the fire a little bit about diversion, we're going to see really good, respectful diversions that are appropriate. And we're also going to see some kids who enter the foster care system and parents get services and the child gets services and the caregiver has access to supported permanency. We're going to need to ask our child welfare agencies to do that. We're also going to need to think about, in terms of our informal options that Sasha talked about, guardianship in Nevada. It might sound like be something slightly different in your area, but guardianship, you can start working and seeing that your forms have things like visitation built in, or what is the path to get a child home for termination of guardianship. We can start taking some of the best practices that we know from child welfare and putting it in some of the legal pathways on the informal or outside part of kinship care so that it is more clear. What is it going to take for a child to get back home if we do this guardianship? What does the parent need to show? How often are we going to do visits? We could start being more explicit with our legal tools outside the system to sort of mirror some of the opportunities that kids have to return home on the inside, in the formal system inside. We also talked about family therapy in our past session. We think family therapy for the entire kinship triad, the caregiver and the parent and the child, is so important, because when we can find healing between that caregiver and the parent, that's when the magic happens. I've seen the best outcomes for kids when there's healing between the caregiver and the parent. And so finding ways to practically support that, and therapy is one of them. Family mediation is another one. giving families tools to be able to start having these difficult conversations after maybe years of difficulty and working towards the best interest of the child. We've got to start supporting that. We believe strongly that parents need way more support than they have access to right now. And we also don't want anyone to leave this session thinking that we want every child to be in foster care so that they have access to resources and that parents have access to support. We think we need to be delinking more resources from foster care into outside kinship care so that families have similar equitable support. I want all children in non-parental care to have access to the same support and the same pathways home as they do in the foster care system. And right now that's just not the case. So we need to start talking about where those areas are not equitable. We think all families deserve to learn about trauma, not just the kinship families that come through in our state for licensing and get an opportunity to, they're kind of forced to learn about trauma through our classes. But by the time families are done, they kind of want everyone in their family system to have learned about trauma. And we believe that if we can have a more trauma-informed society, we're going to see a whole lot less trouble. I mean, trauma is really at the root of so many of the things that we deal with. So we would absolutely love to see that there is trauma-informed training for all kinship families, not necessarily just the ones who are caring for children in foster care. And trauma-informed visitation centers for all families. Again, not just for families involved with foster care, but wouldn't it be wonderful to have a visitation center that is trauma-informed for those families outside the system that are working hard on their own to figure out how and when is it appropriate for kids to be reunified with their parents. So lastly, I just want to challenge all of us who are working in the kinship space in a Navigator program. At Foster Kinship, we're a nonprofit, so we have some flexibility to sort of start thinking innovatively about programs that are needed. And I strongly believe that Navigator programs that are supporting informal kinship families need to start thinking about expanding services to birth parents. We know that Navigator programs are not going to be the glue that puts families back together, but I also believe strongly we can create a safe space for families to heal. And we create a safe space for healing by acknowledging the whole kinship triad. It's not just grandma and grandchild. It's grandma and her child and the grandchild. It is all three in a kinship family system. We need to acknowledge that and provide that space for family healing. So not only do kinship Navigator programs need to provide really accurate and timely information for the whole kinship triad, they need to help parents and kinship caregivers understand the differences between resources inside and outside of the system. They need to understand critical timelines, and they need to advocate for any child who is physically separated from a parent to have a potential way back. It can't just be, kids in formal care have a way back and kids in informal care, yeah, we don't know, good luck. We have to start thinking about having a way for kids to go home regardless. And so kinship Navigator programs, I think, can be well positioned to call out some policies, practices, and laws that really kind of harm one kinship party of the triad at the expense of another. Example, child only TANF, the kinship caregiver has to put the parent on child support, excuse me, I was in birth control. Maybe I was like, it's like close enough. No, and child support. And that kind of pits the two against each other when they really should be working towards the child's best interest and working with each other. And so Navigator programs can start calling out those policies and laws that don't seem right and kind of working counter to what we all want for kids. And I really think that innovative kinship support programs can start thinking about, expanding their family stabilization services to the entire family, including therapy, mediation, and visitation, to make sure that there is a potential way for kids to return home if it's safe and appropriate, and at least there's an opportunity to start talking about it. So we just wanted to share that. I'm going to end my presentation here, and we're going to have our keynote from Leah next. But let me know what you think in the chat. If this is helpful, if this was helpful to think about, really starting to challenge our kinship support partners across the country to start thinking about how are we going to look at reunification on the informal side with the Families First implemented everywhere. Let's start talking about it. So please reach out to me if you have any questions. Things to add, great things that your jurisdictions are doing. We really want to make sure that we have sort of an advocacy coalition of kinship support programs that are really thinking about some of these tough ethical issues. And thank you very, very much for your time.